And I have the honor to introduce Professor Thijs Merkx, who is well known to you if you are from the Dutch part, to you as your Chief Executive Officer and Chair of your Board of Direction, and in binome with Valery Lemmens. It is so strong for a cancer registry, and we cannot but emphasize this, to have the guidance of and a collaboration with clinicians, and like you, Professor Thijs Merkx, in maxillofacial and oral oncology. But I think that a strong bond between clinicians and cancer registries can really make things move forward. We met some months ago for an informal discussion to brainstorm on how to give visibility to our cancer registries, and there is no doubt that you will give that as a person and that you are already doing so for the Netherlands Cancer Registry. I have an important question now for the public, so you need to work up a bit now, and you should launch in the special word cloud that should become visible at your screen, to launch a word that comes up to you when you are thinking about how can data in cancer registries help us to overcome challenges. So the first word that comes up in your mind, please launch it in the word cloud. And I think that Professor Thijs Merkx and the panelists will be happy to look at it and to discuss with you. So I leave my chair now to Professor Thijs Merkx.
Thank you very much. What an enormous word cloud. One word actually is the most important, and that's prevention, although inside and insights are mentioned twice and is actually the same word. So inside, or insights, and prevention. Let's go to you. What is your first reaction on the words insight and prevention from patient perspective?
Well, thanks. What comes to mind actually is we need more prevention, we need early detection, and to achieve that I would assume we need insight. And when I say we, I speak as an ex-patient, but also as a representative of patient organizations. I think that it's time also that we can start asking ourselves as patient organizations, what can we do to help educate citizens, the general public, so that we can increase prevention and also increase early detection.
And Robert, if you look to the clinicians, and I'm a representative of those, how can, from your opinion, from your perspective, insights help the clinician?
Well, it reminds me of once I gave a talk to clinicians, and it was a question that I asked myself before starting. And how can we do that? I think that it's good to understand the patient perspective. But again, when I say patient perspective, I'm speaking about our need to increase quality of life. I want to say as well that I do not want clinicians either to be putting themselves in the shoes of patients, because I want you to do the best job possible. So I want you to understand that when you need information, that there are resources to get information to better understand why you're doing certain work and how it can help to increase the quality of work that you're doing, so that we can benefit from that.
Before I go to the next one, one additional question, because you do not mention it, and I want to be sure that you mean it, and that's the quality of the data, because insight has always to be based on the same level of the quality of data, because if you do not have the same quality, also from national as international perspective, the same data dictionary or thesaurus, then you have no insights.
Well, my request to organizations would be to collaborate with each other. My request would also be, when collecting data, to think about the moments in time, for example, when collecting patient-reported outcomes, when the questions are being asked. If we can guarantee that the results that we get from those questionnaires, that they truly represent the patient's perspective. So 2 things. I would request for better collaboration. I would also request that we keep in mind that the outcomes that we receive needs to be validated, and it needs to truly give a picture of what the patient is actually feeling and what they want us to be saying as well.
Thank you very much. Siri, if we go to you. Ladies first, sorry. If you hear the answer of Robert and the questions I asked about word cloud, what is your answer, or what is your perspective on prevention, insight, and quality and continuity of data?
Very good questions. Of course, much of the same as you're saying, that through the cancer registries, for instance, we collected a lot of data that can be used, for instance, for knowledge-driven decisions for the clinicians, to help clinicians base their decisions on statistics, long-term statistics, high-quality statistics coming out of this. But we also need to think broader. As I said in my presentation, the cancer registries are the fundament, and we need to build on that with, for instance, patient-reported outcome measures, to put this together to make it even more valid. So you would get insights to treat the patient the best possible way. And for prevention, I briefly mentioned also using cancer statistics to see where is actually the issue, what can we do to tailor-make our what we say to the society for prevention for melanoma, for instance. Where should we aim our measures? Yeah.
And the aspect of collaboration is also meant from international perspective.
Yes.
And you are normally cooperating with Scandinavian countries, but not with, for instance, the Netherlands Cancer Registry, or the Belgium Cancer Registry, or the France Cancer Registry. How do you see cooperation from that perspective?
I think we need to cooperate even more, because the more data we have, the stronger we will be. And there are some challenges to it. We are cooperating a little bit with the Netherlands, but
a little bit.
Yeah. So I would ask for more cooperation like that, and to build on each other's experiences and the knowledge that others have, and build us even stronger. So European and even international collaboration is key, I think, to both to be able to prevent and to treat cancer patients the best possible way in the future.
Thank you. Johan, your presentation was very clear, Dutch cancer agenda. And we talk about healthcare, but actually healthcare is very small if you see the numbers Valery, for instance, showed us. Have we to look broader than only the Ministry of Health? Because have we looked to education, Have we looked to the Ministry of Finance, Economics, Social Affairs? So how broad actually is your national cancer agenda, and not your, but our cancer agenda? And how do you see this to make it not too big, but on more tables than only the Ministry of Health?
Yeah, it's a good point, Thijs. Although I should hasten to point out that the health budget, the health ministry, is the second largest item on the national budget, and with business as usual, it will overtake social affairs very quickly. So that in that sense, this is already a big thing, right? So health is, I think, the primary sort of systems responsible from the central government point of view. It doesn't mean top-down planning, but they are the very first ones we need on board. And maybe I can refer to the Uncode Institute, which is a fairly recent Dutch innovation. So it's not a bricks and mortar institute, it's a virtual institute. It brings together hundreds of top scientists, but it has a very important and innovative valorization function. So the institute I call bilingual, so it speaks the language of business and it speaks the language of science, so we can accelerate the findings even of basic research quickly to society and the patient. And this is, so there are three ministries investing here. So healthcare, the health ministry, economic affairs, as they also see returns coming from working together with startups and pharma, and obviously education and science. So those are the three obvious candidates to participate, which is an initiative, sort of, it's public-private, so it's 50% charity money and 50% coming from government. Although interestingly, government increasingly thinks in terms of revolving funds. So we have sunk assets, and the government wants, we want my money back.
Yeah.
That's an interesting position from government. I don't want my money back. I want societal returns back. Now, which is a different type of stakeholdership. So I'd say it does cut across the board of government, but if we start with the health ministry, it will be a very, very good start, as we would like to help them not to topple social affairs as the biggest item on the national budget.
Your answer is not clear to me if you look it from Ministry of Education. How do you see them involved?
Obviously on the research agenda. So
only from the research and not from training from high school to university to become, if you look at this moment, the capacity of healthcare cooperators and nurses, doctors. So from that perspective?
Same thing. So you're right. I was just thinking of research coordination, because there's a lot of research money available, both in the Netherlands and in the European Union, but the windows are quite separate. And we don't know about the redundancies, we don't know about the lags.
Maybe it's not clear, but here in the Netherlands we have a Ministry of Education and Research, and that's the same one.
So I was thinking of research first and foremost, but you're definitely right that the whole chain, educational chain, needs to be involved.
Valery, if you look to the questions and the answers here, and you look at from my perspective as a clinician, and you look to my job as a OMF head and neck surgeon, on the outdoor patient clinic, on the OR, on the ward, what is your advice to me as a clinician how to take your message into my Friday practice?
I'll come to that in a minute, Thijs. Maybe first I would like to reflect on the word cloud. Me personally, today I had two objectives, two goals. First of all, I wanted to make clear the importance of patient involvement in the work that we do. Mm-hmm. Second of all, I wanted to make clear the important role that cancer registries in the Netherlands and in Europe have when it comes to prevention. And I think we have achieved today both of these goals. This afternoon, Hans Nijman told it already. It was clear that for IKNL, patient involvement is key. And looking here at this word cloud, thinking back of the presentations we heard this evening, I think nobody will doubt anymore that prevention for cancer registries is one of the key aspects to focus on in the forthcoming years. Now, you asked me about advice. I think in the current situation in society, with the COVID pandemics, with all the measures, I think there are a few things that we have learned about. One of the things that we have learned is that if there is enough pressure, we collaborate, also internationally. Second, an important lesson is that we have to rethink how we deal with healthcare in the Netherlands when it comes about the smaller getting working age population in the future and the enormous amount of elderly we have to take care of in the future. So your question, what can you do as a clinician? Please make sure that not only becoming a doctor, but becoming a nurse, working with patients becomes more attractive for young people to study, for young people to take up these jobs. We need them in the future.
So be proud on your job and help the younger generation to become a healthcare worker.
It starts with education.
Yeah. You look to Johan as...
Well, yes, but then we need more than applause once in a while, right? So then the profession, especially when it comes to the nurses and the non-medical specialized staff, so to speak. I mean, they need to earn a more decent salary, but also in terms of, I think, societal appreciation. They need to move up the ladder. And I don't know what we've done in the country the last 10 or 15 years, but all these pivotal roles, the teachers, the policemen, the nurses, you know, we didn't treat them in the way they deserve to be treated. And I really think that needs a system change. And, you know, because we can talk about it and nice and whatever, but we need to pay them well. They need good career perspectives, and we need to appreciate their jobs much better than we currently do. And not only in the middle of a pandemic.
And I think COVID is a good kick in the butt.
It is.
But we have to keep kicking butts in the next few years.
Well, we will.
Siri, if I look to the word cloud additionally, prevention, and it's not quite different in the Nordic countries, I presume. How do you look to the impact on the prevention agenda in the Nordic countries? And do you have in the Nordic countries a comparable cancer agenda? Or is there Norwegian, Swedish, Finnish, Danish, separate cancer? Do you have, how is it organized? And what is your perspective if you hear the voice of the head of the European Committee, von der Leyen?
I don't know all of the cancer plans in the Nordic countries by heart, but there's a very good cooperation both between the cancer registries and the cancer unions in the different Nordic countries. So they work very closely together, and the Nordic cancer unions also work closely together with the Association of Nordic Cancer Registries. So we are trying to pull at the same threads and make a joint effort to, because we can't live without each other. It's cancer societies need the research and the data from the cancer registries, and the cancer registries need the cancer societies to provide the direction and the patient voice and everything into this. So I think it's quite comparable between the Nordic countries, but of course some differences always exist.
So you're not asked for input in the separate national cancer agendas by the call of von der Leyen and the Commissioner of Health from a European Committee?
Actually, I don't know. Oh. I could check that, of course,
okay,
but yeah.
And so that makes the shift to Robert. Robert, you are a representative of the European cancer patients. So do you have any information for us how in Europe the patients are allied to or informed about the separate national cancer agendas? And do you have, from patient perspective, a cooperation with each other? Because you were this cooperation, but I bounce it now to you.
Okay, that's a good question. I'll give you my opinion on that. First of all, collaboration. I am an advocate for collaboration. And when I say collaboration, I mean between patient organizations as well, across the board. We lack that. We do not collaborate enough with each other. We talk about prevention and early detection. Prevention means reaching out to the citizens. Early detection means as well reaching out to the citizens. What I often mention and talk about is the fact that we organize a lot of events, patient-related events with a whole lot of data, but we're talking to patients. And what I would love to see patient organizations do is reach out to citizens. The data, the statistics that we have the experience of what it is like and the impact that having cancer has on our lives. So I'm sure that there's more we can do to also motivate the citizens to work harder when it comes to prevention and also educate them on early detection, what is necessary to detect cancer at an earlier stage.
May I challenge you?
Of course.
If you go back tomorrow to your job, being an advocate on the European Cancer Patients Organization, what is your personal take-home message from this evening, and how are you going to advocate this evening with all the messages from the persons here on the table?
Well, I don't think that I'll have to leave this evening and then bring across a message. Most people who knows me know that I'm not the easiest when it comes to advocating what I believe in. But definitely a message, that a question I would ask is, what can we do as the European Cancer Patient Coalition and all the other organizations that I'm affiliated with, what can we do to motivate, stimulate, and facilitate collaboration between organizations? That will be my question.
Yeah. Okay, that's a nice challenge for yourself and for us as well. Last question to Johan as Dutch Cancer Foundation chairing and looking to the National Cancer Agenda. You mentioned a few key points and a few challenges. How do you think that we as Dutch Cancer Patient Federation and IKNL can reach these endpoints, and how the partners in crime, sometimes called, as well as the parties to cooperate with, can help us? So what is the perspective in time and in moment for us?
Writing the plan itself is not so complex, right? So if you get the right people in a room and you feed them and give them a drink and you keep them in there for a week or two, you have a great plan. Literally hundreds of cancer control plans have been written in the Nordic countries, in the UK, in France, in Cyprus. We have done it before. The thing is the whole journey. The journey is, in a way, the end. It's like what you tell your children if you go to the south of France. You say, "Hang on, our vacation has started when we have left home." This is the same story. So we actually need the engagement of stakeholders, and I've made a desperate plea for government to come on board the moment that they have their cabinet fixed, and no day later. Also for democratic reasons, because obviously Parliament is the highest democratic organ in our country still, and has actually asked the minister, with 150 votes in favor, to draft that plan with us, with no further ado, and then work with stakeholders to find the smartest possible solutions, because sort of the individual parts of the whole cancer mechanism in the Netherlands are excellent. But making the whole machinery work so that we can actually rise and win that Olympic medal, the Olympic medal of cancer control, we need that cooperation, we need that journey, and we need the engagement of everyone involved.
Thanks for your answer, and we are aware of the big challenge we have together, and it was a nice forum discussion. Thank you to have you here on this table. Thank you for the answers, thank you for the discussion. And I give the work back to Lisbeth, our famous chairperson this evening. You did a marvelous job.